And the first step is you would tap the victim on the shoulder and shout, "Hey, hey, are you okay?" If they're not responsive to what we call verbal stimuli, so tapping and shouting, then we go to a sternal rub. And that's where we take kind of the knuckles of our hands here and we rub on the sternum, or kind of the chest bone, the breastbone. Or we rub for a few seconds, and if they're not responsive to painful stimuli, we determine that they're unconscious. When we make that determination, then we go and determine, are they breathing? Do they have a pulse? And we do that by doing a head tilt chin lift, and we're feeling for breath on our cheek. We're looking for their chest to rise and fall, which indicates they're breathing. And we also take 2 fingers and palpate for a carotid pulse, which is a pulse point you have on the side of your neck. And if the answer is no, for all those things, that they're not breathing, they don't have a pulse, then we need to start CPR. So we would have a bystander grab their phone and call 911, or if we are in the unfortunate situation that we're by ourselves, then we would call 911 and maybe throw it on speakerphone so we can continue on with the steps. First thing we do with chest compressions is we have to get our hand placement correct. So we palpate, or we feel for the edge of the ribs that kind of come together at a point near our chest. And where they come together there, we feel about 2 fingers above that. And then we know that the palm of our hand goes just above there, right on the middle of the chest, or over the sternum, which is that bone in the middle of the chest. We use the palm of our dominant hand, and that goes on the bottom, and then our non-dominant hand goes on top, and we interlock our fingers just like that. The body position for during chest compressions, we want to be to the side or perpendicular to our victim, and we want our elbows nice and straight, locked in a straight position. We want our shoulders over the person's chest, and we're really, a lot of our motion is coming from our hips, so we're really hinging at those hips and keeping everything else straight. We compress at a depth of up 2 inches or more for an adult, which is quite a lot when you think of it. And sometimes when we're doing this, it would be normal for us to feel a crack, which it could be a rib breaking. So we continue at 30 compressions to 2 breaths. That's our ratio for adult and child CPR. And the rate is about 100 compressions per minute. An easy way to remember that is you pick a song that has a beat that's about that pace. And one song that's in CPR classes is Staying Alive by the Bee Gees. So in CPR, you do that 30 compressions, 2 breaths, and you go back and forth. The 2 breaths, when you deliver a breath, you do a head tilt chin lift, so you're extending that neck back just a bit, and you're breathing into their mouth and or nose, depending on the size of the face. If you can get your mouth around the mouth and nose, which is more common for a small child or infant, then you can breathe both. If not, you pinch the nose for an adult, breathe just into the mouth, and you give just a nice full breath in. You should see the chest rise, which means air is going into the lung. That's a great thing. So you do 2 breaths, back to compressions. And you do this cycle for about 2 minutes, which is about 5 ratio of 30 to 2 breaths and chest compressions. Then you recheck, do they have a pulse? Are they breathing? If so, that's a wonderful thing. If not, you jump right back into it and you continue till EMS gets there. So they make AEDs where someone that has no training on them could figure it out. And that's a really great thing, because oftentimes you only use this once, or hopefully never in your life, but the first time you use it could be the first time you've ever seen one. They try to make it where even an elementary school child would be able to figure out an AED. And once you turn it on, it will take you through the prompts. It walks you step by step through, and it's got pictures, and it will actually talk to you to say, okay, remember, did you call 911? And then it goes to the next step. Place the pads on the person's chest. And it's got these sticky pads, and it shows you on the stickers, where on the chest do I place them? And it shows you here and here, and there's nice pictures, so it's easy to see. Then it will read, once the pads are on the chest, the unit recognizes that. So that's great. Once it senses that they're in the right spot, it'll tell you, okay, you've done your job, now hands off, because the unit's going to work now. And it'll analyze, and it'll say, hands off the patient. And once it analyzes, then it'll tell you either deliver shock or no shock advised. And if a shock is advised, this little heart in the middle of the AED unit lights up, and it just beeps like that until you actually push the button. And that's how you deliver shock. Pretty easy, user-friendly, and then it'll walk you through, okay, start chest compressions again, start some breaths, and go through your CPR again.